So hello everyone, welcome to another important video. So in this particular video, as you can see, we are going to talk about the latest global health emergency declared by WHO for Mpox virus. So in this particular video, let us understand what exactly this virus is, what are the methods of transmission and communication, what are the symptoms, and finally, do we have a treatment for this kind of global health emergency? So make sure you watch this video till the end and subscribe to the channel so that you can get notification for important updates like this. Let's start. So first and foremost, let us understand what exactly is Mpox. So Mpox stands for monkeypox, which is a viral infection that affects primarily humans as well as the animals. Now, this is not the first time, but the second time since 2022 that the WHO has declared Mpox virus as the global health emergency. This particular virus has been spreading rapidly in the African continent, and there has been reports of its risk entering into the Europe, and Sweden has also reported cases of Mpox virus. This particular virus belongs to orthopoxvirus genus, and this typically can cause chickenpox like symptoms, which can cause rashes, raised bumps, or blister in the skin. As you can see in this particular photo, the child is affected by that particular Mpox virus, and this particular Mpox virus is similar to the eradicated smallpox virus. Now we have all gone through the smallpox, chickenpox, okay, and this particular poxoviruses is also similar to the cowpox and the vaccinia virus. So this is about the Mpox virus. Now let us understand what are the symptoms of this particular virus. So whenever a person is infected by the virus, 75% of the time the rash takes time to develop, and first you would find that particular rash on the face itself, then it can go through palms, the genital area, as well as the soles. Okay, so the face would be the primary symptoms where the lesions you would see. What are the symptoms of this particular virus is that you would get fever, intense headache, muscle ache, back pain, low on energy, swollen lymph node, as well as the rashes on over the skin, which tends to form lesions. Okay, so these are the symptoms. So if you have symptoms, it can be for some other virus also, but please make sure that you are aware that these symptoms are very similar to Mpox virus. Now let us understand what is the mode of transmission of this particular virus. So first and foremost, the rash is developed. Okay, then it converts into blister, which converts into bodily fluids, and scabs are formed. Okay, now this particular monkeypox virus can spread through a person infected through it. It can spread through clothing if you are wearing clothes, or if there are clothes in the mix of the person affected in the Mpox virus. Then it can also be transmitted through the bedding, the towels, as well as the utensils also. Also, if you are in intimate contact with the person affected with Mpox virus, then it can transmit through saliva, skin to skin contact. Also, it can pass from mother to child. Okay, so the transmission of this particular virus is serious, and it can affect child also. So it is similar to other poxoviruses where it can transmit from person to person, and also through bodily fluids and the clothes used by that person. And now this particular virus is affecting from mother to the child. That is a serious cause of concern. Okay, so the person or the lady who is affected by this particular virus can also transmit that to the baby. So the pregnant women are also advised to go through all the vaccination that are mandatory to be taken during the pregnancy, and also keen focus on the poxovirus vaccinations. Now the most important question comes, where it is very important to know whether there is a treatment for this particular Mpox virus or not. So the infected people should let the rash or the sores dry out like you do in the chickenpox. Also, make sure that whether the lesions or the sores are covered, okay, with the dressing that is very much dried. Okay, so do not keep it wet. So once it dries out, then it can reduce the symptoms, as well as the soles which are available, then avoid touching that particular sole so that it does not transmit from one part of the body to the another, or one person to another. So it is very important for the prevention or the treatment point of it, to avoid touching the source, to have cortisone free mouth rinse. If that's available, you can use it. Then cortisone free eye drops can be used to reduce, as well as the vaccination when it comes to treatment. Then the vaccination developed for smallpox is known to be effective against mpox virus also, since it's from the family of poxoviruses. Then smallpox vaccination can also be taken. Also there is antiretroviral treatment like tecovirimat or tpox. So that particular treatment also you can take. Okay, so there are treatment available, there are avoidable situation. So it is very important that you avoid first and foremost. And if you are contacted with it, then make sure you visit to the healthcare professional and you take the proper treatment. So this is about the mpox viruses. So thank you for watching this video till the end. Please make sure that you subscribe to the channel, so that we can bring you amazing information such as this global health emergency, and we can keep you updated with the latest and the information available in the world of medicine and clinical research. Thank you.